Let's get more perspective on Zimbabwe's law outlawing organized protest by healthcare workers. Joining me live via Skype from Huntersville, North Carolina is Dr. Simbiso Ranga, an internal medicine specialist and a native of Zimbabwe. Dr. Simbiso, welcome to Africa 54.
Hi, Esther. Thank you for having me in the program.
Thank you, Doctor. Now, what's your reaction to this new law? And does taking medical personnel to jail help in any way the crippled health sector in Zimbabwe?
Esther, it's very unfortunate that the health sector in Zimbabwe has collapsed in so many ways. We have hospitals that don't have medications, and we also don't have basic equipment like sutures and other basics like gloves. And unfortunately, healthcare workers have not been spared. So they are being grossly underpaid. As a result, obviously, they have had protests and other ways to try to have everybody pay attention to the needs of healthcare workers. It's kind of a system where everything has fallen apart and the healthcare workers are crying for help. And I think that this law is not going to solve the problem. It's going to make it worse, going to increase the brain drain that is already experienced in the health sector.
And you're one of those who are right here in the United States working as a medical doctor. What do you think then needs to be done to fix the health sector in Zimbabwe?
What I believe should be done, Esther, is we need a wholesome set of activities that prioritizes healthcare. I know that the government gets a lot of support from development partners to support initiatives like, combating HIV, AIDS, malaria, and so forth. I think that if the government matched some of that support in financial terms, that would help solve some of this healthcare crisis that we are witnessing. There's a lot of lives that are being lost because the government is not paying enough attention to the needs of the health sector.
Doctor, we understand that besides this law, that the government is also barring medical personnel who are seeking jobs elsewhere, going abroad. They're being denied visas or even passports, so they don't travel outside of Zimbabwe. Is this constitutional?
I don't believe it's constitutional. I think what the government is doing is what we call command everything. Command agriculture, command healthcare. There is a problem in the health sector, and all they are doing is asking for more from the workers who are working day and night to provide service. They're actually subsidizing the needs. The government, they're subsidizing the government, in fact, because they are going above and beyond, being paid very little. So instead of punishing them by jailing them for protesting or going on industrial action and denying them visas to be able to travel to other countries, what they should be doing instead is work with the health sector, the nurses, the doctors, and say, what are your needs? What are the needs of the hospitals, which are inadequately staffed, to say, how can we fix this? Instead of saying, let's just ask them to do more, which is what the government is essentially saying. I don't think that's going to work. I think we need more support, financial support. We need more budgetary support. Right now, they said they are devoting 11% of the budget to healthcare. I think it should be about 30% or so. If we just did that, it's going to help ease the problems we are seeing in the health sector.
Dr. Simbiso, thank you so much for your insight.